Hello, I'm Dr. David Hornbrook with another episode of our segments on View from the Other Side of the Bench. As most of you know, I really have two jobs in my life, and one of them is a clinical dentist. I have a practice in San Diego. And secondarily, I'm the clinical director of education at Utah Valley Dental Lab. So my goals with these episodes, View from the Other Side of the Bench, is to try to look at things from a clinician's point of view and the cool things that we do. And then from the side of the bench that the ceramists work with and increasing our communication. The thing we're going to talk about today, it really meets both those criteria, something that we can do as clinicians to offer our patients something a little different, something I think kind of cool. And then, as I mentioned in other episodes, ceramists are artists. And the things we're going to talk about today are ways that they can really optimize or maximize their artistic skills. Today we're going to talk about tooth tattoos. Now, some of you may have heard of that. Others, it's like, what the heck is that? You know, tattoos are popular these days. People like to have that freedom of expression. They like art somewhere on their body. Sometimes they like to expose it. Sometimes they like it covered up. Some would like one, but they're scared. What if they don't want that the rest of their lives? And then the pain and the cost and the difficulty in having that removed. I mean, that's a whole nother option. Well, with tooth tattoos, we can go ahead and allow our patients to have artistic expression with something that can really be invisible or can show outwardly. And if it ever did need to replace, it's much less painful and it's a much easier process. So I actually brought some samples. Utah Valley Dental Lab does an amazing job. And these can be done typically on either lithium disilicate like eMax or a zirconia, monolithic zirconia. So again, I'm just going to give you some samples of some things I found in the lab today. But the cool thing about this is, just like a standard tattoo on the body, your patient can ask for anything they want. It could be initials, it could be a photo, it could be color, it could be black and white. They could bring in a picture of something, a logo, whatever it is. Again, freedom of expression. So this first one is cool. Because we actually have a patient that's a fan of BYU right here in Provo, Utah, and so they wanted to show their support by having a crown that actually had the Y from BYU. Now, what's cool is the shading is really unlimited here. This is a kit, and it used to be we'd have limitations. It would be tooth stains that we put on crowns, which are typically yellow and warm and maybe a little bit of white. This actually has 28 different colors. And they're called tooth paints. And this is actually a ceramic stain. And you know, as I look at this, I think, this is absolutely incredible. Here's 2 different shades of green, and that's only 2 out of 5 shades of green. So there's really no limitation. There's blue, there's purple, there's yellow, there's white, there's black, there's orange. So when a patient wants a mascot of their favorite sports team, literally we can go in there and we can pick the orange from the Cincinnati Bengals and we can make a helmet out of that orange. And so really the opportunities are limitless as far as shading and colors, and those can be mixed, and it's so much fun for these ceramics to do it. And then they obviously use a tiny little brush because we have this little tooth that we're trying to paint a picture on. Again, some of these ceramics absolutely love to do it and are great artists and are very good at it. Another thing we're doing a lot of is either initials or full names or words in like a script, even Roman numerals. You can see here, this is an M with kind of a little design the patient picked out, and they can either be on the front of the tooth or they can be on the back of the tooth. This is a picture of someone's last name, Wolf, and this patient wanted their last name. It's actually an abbreviation for their last name that they go by, Wolf. But they didn't want everyone to see it, so instead of being on the outside of this tooth, of this crown, they actually put it on the inside so their dentist sees it, or if they wanted to show someone that in their life their tattoo, they could do that. Again, it's limitless. This is the inside of this crown. Again, the patient didn't want to show it as much as maybe on an outside tooth. So we have lots of options. Now, typically, as I mentioned, we'll do this with either the monolithic zirconia or lithium disilicate. And the way they design these are in 2 totally different ways. This tooth is a molar, and this patient, it's kind of funny, they said, if you're going to go ahead and crown this molar, let's do a rest in peace, big molar. Okay, great. I'm not sure if I would have picked that, but it's kind of cute. Zirconia, as it's milled before it's sintered, is actually like a chalk. So you can see this is bright white. So what the ceramists did, and the pink is just red or pink, it's a red pencil, and then they can carve in this chalk, they can carve either a logo or initials, or in this case, RIP, big molar. And then when they center it, it'll actually, the crown shrinks down anywhere between 17 and 25%. It'll actually shrink down, the red will go away. That bright white will then be tooth color, whatever shade it is. And now we have the recess where the ceramist had carved in, again, the logo or the symbol or whatever. And then after it's centered, then the ceramist will take the shades or the colors, whatever the patient wanted, and they would fill those in and then fire it again. So zirconia is designed prior to the centering process, and then Emax, because it's wax and press, and this can be done as well in CAD/CAM where they mill this. I think the ceramists, they like to use waxing instruments and carve in the initial or the logo. So this is actually an A, so this is the wax pattern of a crown that's going to be Emax. So the ceramists will carve that in, and most of them use 10 or 20 power microscopes so they can get real detail on this. They'll carve that in, and then what they'll do is they will then press it, and they have that recess that'll be filled in. So in this is a mousse. Again, we're in Utah. We have a lot of people that like the outside. So the patient wanted a mousse on their tooth. So this was carved in wax, and then it was crystallized. Again, it went to this tooth colored, and you can see the recess of the mousse, and then now it's stained with this dark brown black, and so we have this very cool picture of this mousse for this patient. Again, they picked it and they decided that's what they wanted to have. Again, it's really limitless here. This is actually one of the ceramists at Utah Valley Dental Lab. That's our logo, and they wanted to show off their support for the lab. And this is actually the outside of the tooth, so it'll show right down here on the bottom right. Pull back their lip. It's not visible to everyone, but when they want to show off their tattoo, they can easily do that. This is a train. This is a bridge, so we have certainly more certainly room or area that we can cover. And the patient was a model train enthusiast, and they said, you know, if you can do that, can you put a train? And this is actually the upper left, and of course the ceramist and the dentist said, yeah, we can do that. Are you sure? Absolutely sure. And so it was carved in, and then it was painted with these tooth paints. And so again, depending on what your patient wants, you know, it's limitless. And some of the doctors we work with and friends of mine, they actually have brochures in their reception area that talk about tooth tattoos, and the patients are intrigued by that. It's something new, something different. They may be using as a Facebook promotion or even on their website. This again was a Cowboys fan, so patient wanted a logo for the Dallas Cowboys. These last few are kind of cool, a little bit more detailed. This is actually a fan of the University of Wyoming, the Cowboys. To show off their support for their team, they wanted the mascot of the University of Wyoming being a cowboy. This last few are really detailed. Again, these were done by Brent at Utah Valley Dental Lab, and he's just become, with these paints, it totally changed what he's doing because he can do color. I'm not sure why you'd want a pig on a tooth, but you can have it if you want. And so you can see the detail and the artistry of this pig. And I mean, it's cute and it's very, very cool. Handcuffs, we're still kind of debating because we don't know this patient. Is this a law enforcement officer or is this a dominatrix? We're not really sure and we don't really care. But again, you can see this is a very cool example of being an artist. Again, here's kind of a ghost skull. Someone wanted something a little different. And so we do whatever the patient wants. These last two are really, I think, two of my favorite just because they were recently done, and I think the skill level of these ceramists have gotten better. This is actually a wife of a patient that I know that is really into horses. And this is a second molar, so it only shows, and I actually saw her yesterday. So I actually got to see it in the mouth. You know, you have to pull back the lip because it's the second molar up on the upper right. But you can see this horse very, very detailed. She actually brought in a photograph, so Brent could actually match that white stripe down the front of that horse and mimic this photograph of something that the patient is certainly enjoys in her life. And last, again, this is one of my favorites, especially with the popularity of all these Marvel comics. This is certainly the shield for Captain America. And again, we're doing some very, very fun things. You can see the detail, the brightness. This is ceramic stain, so this is not going to fade. It is something that's going to be there until the patient says, I don't like Captain America anymore. Can you grind it off? Which we can, or would replace the tooth. So something a little fun, different. Again, some of you may not know about this. It's something you can offer your patients. What we're finding again is more patients want to have freedom of artistic expression. So give us a call, send us a photo, send us a logo or whatever you wanted on that. Again, we can either do it in Emacs, we can do it in Empress, or we can do it in Zirconia. We could do it in a PFM. We're just finding dentists aren't using PFMs very much anymore. I hope you enjoyed this episode from A View from the Other Side of the Bench.